already popping there. Hey, what's cracking, guys? It's Dr. Nevel, aka Dr. Ginger Ninja, and today I'm here with Chad. And Chad, you've been having some low back pain.
Yeah, when I sit down, I'll be leaning forward on the phone or something, and then when I sit to stand back up, I'll get sharp pains right here in the lower back area.
Now, what was it that originally created the pain?
Originally, I was doing roofing, and we were tearing off a roof, and I was kneeled over, bent, using a shovel to tear off the shingles and whatnot. Okay. And then after that, I nailed the roof off, and in that, it was a lot of bent over and exacerbating.
Just putting a lot of stress on your low back. A lot of
stress on that, yeah.
Okay, and you were saying that it's coming down the left leg?
Yeah, I get sciatic pains every once in a while. It hasn't happened in the last month or two, but I was getting sciatic pains shooting down both sides.
Okay, all right. Now we've been working on Chad a little bit. We've actually already ordered an MRI on it. We've got that back. You have a few disc bulges in the lumbar spine. The biggest issue, though, I believe, was at L5S1. You had a disc herniation, a biforaminal disc herniation that was pushing on your S1 nerve. Mm-hmm. So luckily we have already that information of what's going on. So that's what's creating that sciatica. The S1 nerve comes out of the low back, comes down the leg, usually more the outside part of the leg, and kind of comes right into the foot. When you're getting this pain, is it coming all the way into the foot or partway down the leg?
It's mostly staying above the kneecap so far. So
that's good. So the more pressure you have on your back, on those nerves, the further down the leg it goes. Okay. So what we want is, as we're working on this, what we call centralization of the pain. Centralization meaning that it's pulling back into the low back and then hopefully resolving from there. If the more pressure you have on that S1 nerve or any nerve for that matter, the further that goes down. It goes kind of more out to the feet, or if it's in your neck, goes down the arms. So the goal, what we're looking for, is to kind of pull that off that nerve, and then so that it travels more, kind of stays in the back, and then resolve from there. Okay? So what we're going to do is we're going to do some orthopedic and neurological tests, kind of re-examine you, see what's exacerbated, what's feeling good, what bending you different directions, and check out the nervous system, make sure everything's feeling good. Your main complaint is low back. Yeah. You getting any neck stiffness, any neck pain, any problems up here?
Not out of the ordinary, but some stiffness here and there.
Okay, but the low back's the main issue?
Yes.
Okay, I'm gonna bend you to the right here and back like that. Any pain with that?
No, not quite.
Good. I'm going to bend to the left and back like that. Any pain there?
Yeah, a little bit.
A little bit on that side. Now, if you cough or sneeze, does that normally create back pain?
Yeah, I've been trying to hold my sneezes sometimes because the jolt forward when I do sneeze has been causing the pain to shoot into here.
Okay. Now, if you cough or sneeze and that increases pain, that is actually, it increases the pressure around the spinal cord, and if you have something pushing on that nerve, it's a good sign that you're having something creating that pain. It's called a space-occupying lesion, meaning that it's pushing right on that nerve. Mm-hmm. All right, look straight ahead. I'm going to push down the top of your head without messing your hair up here. Any pain with that?
No.
Good. Rotate to the left and back this way. How's that?
That's good.
Good. Going to the right and back this way. How's that?
That's fine.
Good. Lifting up, no change with that?
No.
Good. Okay, we're going to check your nerves and reflexes as well. Check in here versus here. Do they feel equal?
Yeah, just about.
Okay, how about the inside of your leg here versus here?
This side I feel a little more.
Feel a little more sensation there versus there?
Mm-hmm.
Okay. How about the outside here versus the outside here?
Still feel more over here.
Feel more over there? Okay, I'm going to check more distal here. How is this versus this?
That's about the same.
All right, here and here.
It's about the same.
And here versus here.
Same.
About the same.
Mm-hmm.
So kind of in through there and out through there. Okay, so that's kind of some of the upper nerves where you have some disc bulges kind of come around here. This again is that S1 nerve that comes down the outside part of the leg.
Yeah.
Good. Reflexes are good for patellar. Achilles reflexes are good too. Bringing this leg up to the ceiling. Any pain with that?
Oh no, it's just stretching.
Just a muscle stretch in the hamstring?
Mm-hmm.
Okay. Bringing this one up to the ceiling. How's that one there?
I get some little pain down here.
That one's creating a little pain? Okay, does it get worse as I bring this back?
Yeah.
Okay. So that is a test for sciatica. That puts more stress on there. So that being said, you don't want to stretch your hamstring like that. That's going to put more stress on it. So if you're ever bringing your leg up like that, bend the knee. That puts a little slack in the sciatic nerve, and that'll help out a little bit. Or if you're on your back, sleeping at night, a pillow underneath your knees so that there's a little bit of a slack in that sciatic nerve will help the low back at night.
Okay.
As I push in here, how does that feel? Is that tender in there?
A little bit.
Right there?
Mm-hmm.
Okay. So that's that L5S1, right where that worst disc herniation is. That's creating a little bit of stenosis and pressure on that S1 nerve that goes down the leg. Any tenderness through there?
Yeah, a little bit.
Okay. It's kind of tight right through there, probably from guarding from the low back, rolling forward a little bit. Now as I push in the buttocks there, kind of in the piriformis muscle, any pain one side versus the other?
It's still staying more
Still.
to the left.
More so to the left? Okay. Okay, so we're going to start you off on a little bit of flexion distraction to kind of traction out your low back and do a little vibrational massage over that as well. Okay?
Okay.
All right, as that goes down, any pain with that at all?
Yeah.
Right in through there?
Yeah.
Now, if I don't push on it so much, is that better or still painful?
That's actually better.
Okay. So we'll go a little bit lighter with the traction. I'm just going to kind of bring you side to side, kind of stretch that out a little bit. As I go to this side, how's that? Okay?
That's better than the other side.
Okay. get the S1, L5 S1 adjusted here. So I'm gonna have you lay on your right side first so you're facing me. So I'm gonna pre-stress it, make sure it doesn't recreate any pain in that position, okay? So let that shoulder roll back and the hip forward there as I rotate there. How much pain is that?
Not much.
Not too bad? All right, take a nice deep breath in, blow all your breath out. I'm gonna follow that breath down. How are you there? You okay?
Mm-hmm.
Tolerable? Okay. So what we'll do is we'll get that adjusted at the end of your breath there. We'll give a little thrust with it. All right, take a nice deep breath in, blow it out, let the shoulder roll back, hip forward. Okay, yeah, quite a few cracks.
Yeah.
So the cracks are just the gas releasing out of the joint there. What we're really looking for is the mobility to the joint. So sometimes the joints kind of pop and release that dissolved gas that's in the fluid of the joint. Sometimes it does, sometimes it doesn't. Really, what we're really looking for is the mobility that we're creating with the adjustment. So let that shoulder roll back and the hip forward there. Good. How's that? Any pain with that?
A little bit, but tolerable.
Okay. All right. Take a nice deep breath in. Blow it out. Let it relax. Okay. I want you to take a nice deep breath in. Blow all your breath out. Let that relax. Another one. Deep breath in. Blow it out. Nice deep breath in, blow it out, start to lift your head. And what I'm doing is I'm feeling for the mobility of each joint here, seeing what's moving and what's not.
Okay.
So down at 6 and 7, it's a little bit locked up there. Is that tender at all?
Yeah, a little bit. It feels tense.
Okay. So what we'll do is I'm going to get that adjusted here. So I'm going to bring your head to the right as I laterally bend there to there. Oh, it's already popping there.
Yeah.
All right, you okay there to there?
Mm-hmm.
All right, let it relax. Then this way. You okay there to there?
Yeah.
Contact right in your armpit. Bring this arm across. Take a deep breath in. Blow it out. Let the shoulder relax. Good. The elbow relax there. Same thing on the side of your neck. A nice deep breath in. Blow it out, let the shoulder relax. Let the foot just relax there. I'm gonna give that a little pull. You okay as I pull there?
Mm-hmm.
Then here. How's that? That okay?
Yeah, it feels good.
bend this knee here. Here, give that a little stretch through the piriformis. Does that feel okay?
I feel tension down here.
Right in the buttocks there? Yeah. So this will be a good stretch to do throughout the day, because sometimes the sciatic nerve comes right next to the piriformis muscle, and if that tightens up, that will can kind of lock up your pelvis there. Now, in about 20% of the population, the sciatic nerve also actually pierces that muscle, goes right through the belly of it. So when that does, if the muscle contracts, that will compress right on the sciatic nerve. That's called piriformis syndrome. I don't think you have piriformis syndrome. It seems that you very clearly have that pressure on that S1 nerve from that L5-S1 disc herniation.
That side as much.
Yeah. A little looser on this side, for sure. And then put your hands on your hips there. Sit up nice and tall. I want you to push your elbow straight back against me. Okay. Same thing here. Okay, let's go ahead and have you stand up on that. And back up there. You okay?
Yeah.
All right. So you might be a little bit sore from the adjustment. Put a little bit of ice on there. Make sure that kind of relieves a bit if you are from that. And no, sometimes we do spinal decompression with you, so we may want to get you on a little bit of spinal decompression and traction that out. But we'll see how that does today, and hopefully get you feeling better.
All right.
All right?
Thank you.
Sounds good. Thanks for watching.